Welcome to Denver Health Medical Plan. Thank you so much to our nurse line representatives for being here. Can you please introduce yourself?
Hi, my name is Amy. I am an RN call center supervisor at the Denver Health Nurse Line, and I have worked for the nurse line for a little over 7 years.
What is the 24/7 nurse line?
The nurse line is staffed by trained triage nurses. It's open 24/7, 365. We speak to patients on the phone to help them decide if they need to be seen emergently, like call 911 or go to the ER or urgent care, or if we think that they can wait for a follow-up appointment, or even if they can stay at home based on their symptoms and needs. We can't prescribe medications, but we can make recommendations to see if someone needs to be seen for a medication or if there's something over the counter they can take. And we take all types of questions for patients. So don't be afraid to call and ask a question. We've already probably heard it.
Amy, what services does the nurse line offer?
The nurse line can make recommendations on your symptoms and when to get seen and when to stay at home potentially. Some things that we get calls about are COVID, coughs, general cold symptoms, fever, sore throat, stomach aches, urinary tract infections, emergency contraceptive needs, lice and scabies, rashes and bug bites, and sometimes just general medical questions, post-op questions, and we talk to anyone of any age.
Thank you so much, Amy. Who can call the Denver Health nurse line?
The Denver Health Nurse Line is established as a call center for Denver Health patients who are currently receiving their care at Denver Health, those with the Denver Health Medical Plan, those with Denver Health Medicare or Medicaid, CHP, and those who currently live in the city and county of Denver without any insurance coverage. We do not take callers who live outside of the city and county of Denver without insurance. And those who don't seek care at Denver Health, we ask that they call their regular provider or their insurance company.
So, what information will you ask patients for? Like when they call in, what information will you ask patients for?
When someone calls the nurse line, we will ask for basic demographic questions like name, date of birth, a good phone number to reach you in case the call gets disconnected, zip code, insurance if you currently have it, what clinic you go to if you come to Denver Health, if you're established. We'll also ask you what symptoms are going on and what's causing you to call today. The nurses will ask a brief health history, and then we'll ask about a 10-minute assessment question, series of questions that will help the nurses decide, how soon you need to get seen or if you need to seek care and give you the best recommendation.
When people call in, is there a cost to talk to the nurse line?
Calling the nurse line is free for anyone who calls. We might recommend an outcome of a telehealth visit or a virtual urgent care visit at the end of the call. And sometimes there's a cost associated with that, but we would be really upfront and let you know if there's something we recommend that would have a cost. But just calling to talk to the nurses is always free.
How can people reach the nurse line and where can they go to learn more about the service?
The best way to reach the nurse line is to call us 24/7 at 303 739 1261. You can also find out more information if you go to the Denver Health Medical Plan site at www.denverhealthmedicalplan.org.